all of this, it's so emotionally difficult for people. So I would say that journey was completely life-changing.
A cesarean birth changes your life.
We cut through a layer of skin, we cut through a layer of fat, we cut through a layer of muscle, and that's just the abdomen.
And it changes your body.
And then we start cutting on the reproductive powerhouse, which is the uterus that holds the baby.
And it changes your mind.
There's also a lot of data out there that says people who've had a C-section are less likely to go on to have another baby afterwards.
Cesarean births, or C-sections in the medical terminology, are one of the most common operations in the world.
In the United States, over 30% of births are by C-section.
And yet, they are overlooked. I'm Golda Arthur, and this is Overlooked. In this episode, I have an in-depth discussion about cesarean births with two people who have had first-hand experience of them and who have gone on to explore and explain them to the rest of us. They raise questions and issues around cesarean births that we haven't talked about enough, or at all. Rachel Somerstein is the author of a book called Invisible Labor, The Untold Story of the Cesarean Section.
It can cause people all kinds of anguish.
And Helena Grant is the president of New York Midwives.
We talk a lot about autonomy and birth justice when it comes to abortion rights. But do we talk about birth justice when it comes to giving birth?
Helena, Rachel, and I talk about why the rate of cesarean births is so high in the U.S. today, the origin of how this surgery was first performed on enslaved women in the United States, and why cesarean births are still associated with so much shame.
It's like you bought the cookies from the store rather than made them from scratch.
This topic is a really important one for me because I had not one but two emergency cesarean births. Even though they took place 20 years ago now, I still think about them as traumatic experiences that have left a legacy in my body that I feel even now. This conversation helped me make sense of that legacy. If you've had a cesarean birth, or you're pregnant, or trying, this episode is for you. I wrote about the backstory to this episode in my newsletter, and it also has a bunch of links and resources on everything that's mentioned here. You can subscribe to it at the link in the show notes. And if you have a cesarean birth story to share, you can record it and send that in to us. My conversation with Rachel Somerstein and Helena Grant is coming up in a minute. Our health impacts the way we move through the world. The stories you hear on Overlooked illustrate this so well. I hear from listeners all the time who tell me the show helped them understand their own health in a new way or gave them language for something they'd been experiencing. The idea that this podcast could help someone be bolder in their self-advocacy is important to me. So I'm creating a storytelling workshop called First Person Health. Craft, record, and produce your own powerful health narrative. Take a look at our show notes to learn more about the workshop and to sign up. Helena and Rachel, welcome to Overlooked. I'm so excited to be sitting down with you guys today to talk about cesarean sections. And the first question I want to ask you will chart a course for the rest of our conversation, and it's a pretty pivotal one. What do you think is the most overlooked aspect about cesarean sections, and where is that inequality felt most deeply?
I'll start with just what I think is most overlooked, and there's so much that's overlooked about them, is that they are the most common operation in the world, and that in the United States, over 30% of births are by C-section. So what's overlooked is like how widespread they are, how common they are, and how even if you think that you're not going to have one, the data is there to tell us that there's a sizable chance that you will. But to the first part of your question, they're not distributed equally across all groups, which, Helena, do you want to get into the disparate impacts, or do you want to talk about what you feel like is most overlooked?
I'm just going to piggyback off of what you shared, Rachel. Yes, it is the most common surgery in America. And I think what's deeply overlooked is how, when you have one cesarean, you are often told that you cannot have a vaginal birth after cesarean. And that is the outlier or the best kept secret about why the rates are so high. When you have a cesarean section, there is special criteria that's really not so special that you can meet so that you can have a vaginal birth after cesarean. Many clinicians overlook giving the patient that level of information, that level of autonomy, that level of shared decision making to be able to say, I don't need to put my body through a second surgery or third or fourth. I will also caveat that with many of the cesareans that are done are unnecessary. There is something in obstetrics called a cascade of interventions where a person could come in perfect labor and things could get done to their body that they may just accept as regular part of medical practice that then put them on a pathway to having a high risk of having a cesarean birth. And those are things like an induction of labor for no reason, or early rupture of membranes, being put into bed and epiduralized so that the woman is not walking around so that her baby can rotate through the pelvis in a healthy way that facilitates birth. And these are the things that make it quite easy for the C-section rate to be as explosive as it is.
Yeah, Helena, and I hope that we will pick up on all of those threads and talk about them in the course of this conversation. I should say that, well, you guys know this already, but for listeners who don't already know all of my personal details, I've had 2 C-sections. I had them in London and in the UK, which has, a different healthcare system on the NHS. I was actually amazed at how some of these really common themes come up when I read your book, Rachel, Invisible Labor, which is such a powerful book. And for me, actually a difficult book to read and difficult in all the best ways. I have your book right here, and there's this one bit that jumped out at me that I wanted to bring up in the course of this conversation. You write, this operation, this life-saving and life-changing procedure is like falling through a trap door. And that was one of the moments where, I read that line and I closed the book and I thought, wow, let me just think about this for a second. That really resonated with me. So I want to start with that. Let's talk about how a C-section changes everything. Rachel, I know you wrote an entire book about this, but I want to ask, what did it change for you?
Where do we even start? There's that I had a terrible C-section, and there's that I had a C-section. And I think both of those things changed my life. I'll start with the C-section part. And this gets to something that Helena said earlier, which is that there are so many repeat C-sections. So for me, once I had my baby, if I decided I was going to have another one and I had a C-section for my first birth, and I had always thought I would have more than one child, that meant I couldn't just have a baby. Like, I had to make a plan. I'd had a C-section. What's the plan for the next birth? That would be the question that would start every single meeting with any provider. A lack of agency almost, that I now can see that's what it was. Again, I couldn't just have the baby, which isn't to say that vaginal birth is easy and like you just go in and have the baby and the baby falls out and there's no trauma or there's no effort or there's no uncertainty or anything, and every birth is different. But just in the sense of like, I had a decision to make, and then I also had to find providers who would be on board with the decision that I was going to make. That was a kind of journey through motherhood that I would never have imagined would be part of having another baby after a C-section. And in talking with lots of moms, that flexion point of like, I had a C-section, I want to have another baby. How do I have that next baby? I think is also really overlooked in terms of it can cause people all kinds of anguish. If they want a VBAC and they can't find somebody who will really support it, if they find somebody who they think will support it, who then changes their mind, if they feel racked with guilt about like, well, I think I want to have a VBAC, but I'm being told that it's really dangerous and it's bad for my baby. And how could I put myself over my baby? All of this, it's like so emotionally difficult for people. So I would say that that journey was completely life-changing. And then on top of that, I waited longer than I would have if I had had a vaginal birth, I think. And partly it was a traumatic birth, but there's also a lot of data out there that says that people who've had a C-section are less likely to go on to have another baby afterwards.
I just want to say that I hear the inflection in your voice change. That's the midwife in me when you even talk about it. And what I will say is, it is a hell of a thing for your body to be put in a position, and for your mind and your soul and your spirit to be put in a position where you're taken over. You're taken over in a way where you're deeply helpless, and it's not just saving you. If you don't do this, then you're responsible for harming your child. Like, the psychology of it is pretty serious. The reconciliation of that, I think, is not talked about and is deeply overlooked. And then the bravery and the courage of navigating what you just described, to even put yourself in a position to have to go through that again, and to then be told, no, it's not a good idea. We talk a lot about autonomy and birth justice when it comes to abortion rights. But do we talk about birth justice when it comes to giving birth? It is physically traumatizing. It is psychologically traumatizing. And I'd say it's spiritually traumatizing as well.
Yeah, and I think there's also this legacy in the body. Like, I remember, just speaking from personal experience, I don't think I understood what happened during that operation until many years later, until I started to kind of put the pieces together. You've got this baby, and I have to say, I was not the most natural mother in the world as well. So, there's a lot of things kind of coming at you. But for me to fully understand its impact on my body, I think that took many years. So what is the legacy of the C-section within our bodies?
Well, I guess I would say the legacy of the cesarean birth, because you notice I don't say C-section, because it's still a birth and I want to honor that. C-section actually comes from dissection. A lot of people don't know this history from autopsies. And so I really have tried over my years, when I really kind of got pushed to the forefront in midwifery leadership, to kind of pull back some of the violent language that we use to describe birth. But to answer your question, a normal childbirth, a vaginal birth that is uncomplicated, it takes the body 18 months to heal, for the iron stores to completely come back, for the lymphatic system to renegotiate space within the body, for your cardiac output. A lot of people don't realize the heart works 40% more harder when you are pregnant. Your cardiac output increases by 40%. My God, all the psychological factors that go on. So that's the legacy, even when everything is perfect. Now, what we added was, we had a surgery. We cut through a layer of skin, we cut through a layer of fat, we cut through a layer of muscle, and that's just the abdomen. We pushed organs out of the way. We moved the intestines out of the way, the bladder. We don't want to nick the bladder, okay? And then we start cutting on the reproductive powerhouse, which is the uterus that holds the baby, holds the amniotic fluid sac, and holds the placenta. And we pull it apart. C-sections, they are very strenuous on not only the woman's body, but it's not just instrumentation. There is tearing, there is ripping. Sometimes the opening needs to be made larger. So the healing process is probably more like 26 to maybe 36 months when you have a cesarean birth. Because if we're saying a normal pregnancy with no complications, no preeclampsia, no gestational diabetes is 18, then what is it when you add the healing and the regeneration of tissues on all of those different layers that were cut through and that now have to go back down the sides, and then the uterus is pushed back in the body? I mean, do we even know? Like, is it pushed back in the right place? Is it just plopped in? Are the intestines happy? Is there scar tissue that is now negotiating space? We know a lot of women have scar tissue because people's bodies do heal. But is it healing correctly? And there is the full body system that has to be renegotiated once we have a vaginal birth. And there is even more time that needs to lapse once there is a cesarean birth because of the surgery and the nature of it.
Yes, and I think the short answer is that the intestines are not happy. The intestines are never happy. And you have such a beautiful way to describe it. And I also take your point about the term C-section, which I've been using for the best part of 20 years since I've had my babies. But actually, it's an incredibly medical term, and we're all just, throwing it around to describe giving birth. But cesarean birth is what I will have to remind myself to call it from here on in. Okay, so something I find really hard to talk about, really challenging to talk about, which you also write about, Rachel, is the origin of this procedure. You write about it very powerfully. I really had to grapple with this idea that people who had C-sections were really considered subpar mothers or, maybe even subpar people, right? And you write about this in Invisible Labor, Rachel, and it laid bare so many disturbing ideas and facts that I'm still sort of processing. Nobody ever said to me, you are less of a mother because you did not give birth vaginally. But I knew this. I knew this as I was giving birth. And I don't know where I would have picked that up from. But there is this idea, right, that you're sort of failing at motherhood before it's even technically begun because of the way you're giving birth. Where did this come from?
Yeah, I know. I feel like having had a C-section or a cesarean birth, which I totally take your point, Helena, and I've tried actually to change my language to varying levels of success. And actually, Helena is the person who really woke me up to not saying the baby was delivered, but rather like that the midwife attended the birth or caught the baby, right, as opposed to delivered. So I just want to say a belated thank you to Helena for that. So in terms of the origins, I mean, I see now the metaphor almost is like if you have a cesarean birth, it's like you bought the cookies from the store rather than made them from scratch, right? And that's like that's what you did for your kid's birthday. I guess you don't really love your kid, right? That you didn't make this at home. So the history, as you alluded to, is one of practicing on enslaved women here in the United States, also practicing on people with physical deformities that would have made it impossible or very, very difficult for them to birth a baby. They could not say, yes, I'm willing to go through this incredibly dangerous procedure, which at the time, why was it so dangerous? First of all, it was a very rudimentary procedure, right? So like the uterus wouldn't even at the time, and we're talking in the United States in the early 1800s, late 1700s, and in Europe, we're talking about 1700s when it was practiced on living women. At the time, surgeons didn't even suture the uterus. They just sort of left it open. So you would be at high risk of bleeding to death. And then also the possibility of infection, right? We didn't have antibiotics. So it's not like you had these women who were under any capacity to say, I don't want this, spare my life, right? Do whatever you can to keep me alive. But because of the tremendous pressure on enslaved women to breed more slaves, and particularly after 1808 when the transatlantic slave trade was eliminated, also physically deformed women who wouldn't have been enslaved, but were also kind of counted as less than ideal or fit mothers. And then also poor people. Women would be subjected to C-sections alongside forced sterilization. In the 70s, there's cases of that in California, and there was recently some evidence that this was happening in the 90s and more recently even in Virginia. So as to say, like, okay, it's easy, right, to sterilize somebody when they're already having this operation, especially if it's something they didn't consent to. So I think that that origin of this operation has absolutely been something that we've inherited now. And it's impossible to point one to one, right? And we're not in the same society. And yet, what you're describing, Golda, this feeling that you're less than if you have a baby in this way, hasn't come from nowhere.
I'm going to add, whether you are an enslaved African who makes it to these shores against your will, or you are an immigrant, you came with your midwife. There's a wise woman in every community who was taking care of the women, and not just taking care of the women, I might add, taking care of the whole community, because midwives then were more like primary care physicians. And so when we go through this history of the cesarean section, the surgical birth on enslaved women and on women who were deemed less than, what we find is this decision that is being concurrently made about not allowing the midwives who have long been caring for the progenation, if you will, on these plantations. You start to see this person is taking too long. These labors aren't timed. And if you're not having that baby in that right time or in a way that is also voyeuristic, because it is important to say that is now become sexualized, the risk is you will get cut to make it happen. And so there is this attachment also to the violence of it, that not only in these spaces that were already so violent, we now have an added extra violence that is attached not only to the breeding, but to the given birth, to terrorize and traumatize certain races, cultures, and classes of women more so.
And just to add on to that, I mean, a legacy of that in terms of like how C-sections are not equally distributed, right, is that now simply being Black and walking into a hospital, and not every hospital, I think it's half the hospitals have this difference. We also have this national data, right? We're more likely to have a C-section than if you walk into a hospital with everything being equal, right? Same health profile, same like risks or not risks of needing a cesarean birth. Just by being in a Black woman's body, we're more likely to have one. On the one hand, you could be like, oh, well, slavery was a long time ago, and yet it wasn't. And I think that the fact of that continued data, that continued higher likelihood, obviously, like racism, contemporary racism is a huge part of this, and there's a lot to be said about that. And to suggest or to imagine that the legacy of practicing this type of obstetric intervention on Black women, to suggest that there's no connection to the history of slavery, is absurd.
And I was also thinking, Helena, you use this word violence. And I think to anybody who has not had a cesarean birth, it might seem strange, but I do think it is an absolutely appropriate word. This is going to be hard for me because I am kind of like, I have drunk from the Kool-Aid, okay? Let me see if I can come up with a pushback question here, just to play devil's advocate on this. I guess what it comes down to is, what is a necessary C-section, right? Because for the two that I had, admittedly, I didn't have my babies in America, and my life was being saved, certainly on that second one, which was a little touch and go. And isn't that what a surgeon or an OBGYN will say? Well, I did what I had to do and saved the life of the mother. So let's talk about that. Let's talk about what is a necessary versus an unnecessary C-section. Helena?
I too had a necessary C-section. I had, in between my pregnancies, I started growing fibroids. 75% of all Black women have fibroids. I believe that fibroids are a way, because of our history of slavery and trauma, that we grow these growths inside of us to block ourselves from being bred. That's just my personal belief. I don't have no evidence. But anyway, I had grown a pretty sizable fibroid. The fibroid was actually in the fundal portion. The fundal portion, if you imagine the uterus looking like a light bulb, the fundal portion is the top part of the uterus. That is called the fundus. The fundus is also the contractile portion of the uterus. It is the part of the uterus that's going to give you the strongest contractions to pull the cervix and the lower uterine segment up to make one canal between the uterus and the vagina, so that there is no cervix. A lot of people don't realize that being 10 centimeters dilated means you have no cervix. But anyway, when you have a fibroid that is in the fundus and some other portions of the uterus that have now scar tissue, I had to get that fibroid surgically removed. I wasn't a candidate after that for a vaginal birth. So I needed a C-section. It was a necessary C-section. I'm grateful to have had the myomectomy and grateful to have had the cesarean birth. But this was not a situation like what we've been describing on this call, where I was forced into an induction of labor through the ARRIVE trial at 39 weeks for no reason, and then ended up having a C-section, and then got told for my next birth, hey, you had a C-section, why don't you just come in and have another one? So I am a good example of a necessary cesarean birth, and I laud my physician who took care of me for doing it.
Yeah, and I'll add to that. I mean, I think I had a medically necessary cesarean based on the people who were taking care of me at the time, because I was at the limit of their clinical skills. But in my second labor, I had the same labor, this back labor, kind of asynclitic head, meaning like the head was sort of cocked to the side. Not easy or ideal for getting a baby out vaginally. And the midwife and the OB taking care of me, who was trained by midwives, were able to move my baby into the right position, and then he just came out. So that, to me, says they didn't have the skills the first time. It was a different hospital and different people. So the answer is like, yes, they do save people's lives. They can be medically necessary. And just looking at the reasons why people have them shows how many of them are not happening for medical reasons. Maybe 87% of people who've had a C-section and have another baby go on to have their baby by cesarean. And sometimes that's medically necessary, but not 9 out of 10 times. So that in itself, looking at the secondary C-section rate can tell us like, okay, there's something going on here that these things are not medically necessary. And then if you look at the two most common reasons why people have C-sections, it's either because they have, and I'm using the medical language, which speaking of violent language, this is a violent way to put it, I think. Failure to progress, meaning like your labor is not going fast enough, or the baby has non-reassuring fetal heart rate, which basically means like there's something going on. Either the heart rate is too low or too high, and the clinician has made the decision that it would be dangerous to continue labor and the baby needs to get born urgently. That is very subjective. There's whole kinds of problems that are well documented with the technology that gives us information about the baby's heart rate. But if we just look at the percentage of C-sections that are because you're taking too long, that in itself, right? You could be like, okay, well, there may be times when it is medically necessary, or maybe the mother makes the decision with her clinician, you know what? I'm fully informed on the risks. I'm fully informed on the benefits, and I'm so depleted, and this is the right thing. To the extent that we actually know that they truly know all the risks and benefits, I mean, that's very questionable, right? I mean, it certainly wasn't explained to me. I signed something in my complete, like, obliterated state, right? Like, what? I don't know. Sure, yeah. I think that the other way that we can answer this question of what is medically necessary is what happens when a hospital or another institution tries to bring down their C-section rate, and how things can become better for everybody, safer for everybody. There's recently a piece in the Times about University of Rochester hospital system, I think, where one of the most evidence-based, effective ways to bring down an institution C-section rate is to share with the clinicians what their personal rates are and have them know all around, this is what your rate is, and is this appropriate? And so another evidence-based intervention is making midwifery care available to people. When you see midwives, the data is there. You're less likely to have a C-section, period. And it's not like that means other parts of your health are worse, or your outcomes are worse, or your baby's outcomes are worse. So I would say all of that shows us, like, yeah, what's the fine number of how many we should be having? It really depends, I would say, on the institution. But clearly, we know they're happening for so many reasons that have nothing to do with medicine.
Well, I think this is a good first step to just keep talking about it, keep asking questions, keep looking at records, And like you said, with those physicians, bring this out into the light, make public these things that were previously sort of not talked about. I want to start to draw us to a close here and ask you guys, let's say you're listening to this podcast and you're pregnant or trying. What do you think people need to know about C-sections? What should they keep in mind? Or what is like 3 good questions they should ask their healthcare provider just so they can go into it with their eyes open?
I always tell friends, family, patients, colleagues, they should never see a clinician that isn't transparent about their rates. I can sit here and tell you all that when I was in private practice, my private midwifery practice had a 6% cesarean birth rate. When I was in group practice, my group practice had a 12 to 13% cesarean birth rate, and we had a 13% repeat cesarean birth rate. So our total C-section rate for the group would be around 22 to 25% given the year. You should know like what your personal rate, what your group rate is, what your episiotomy rate is. You should know if I have my prenatal care with you, is it just going to be with you, or is it going to be with 3 other people maybe? Or are you going to, throw me around like a flapjack, and by the end of my pregnancy, I'm going to see 12 different people and have developed a relationship with nobody. And then the day I go into labor, it's going to be some more people who I don't know invading my vagina. Maybe you won't say it like that, but I would. You should ask about what's to come. People should be able to tell you who they are with real data. And if they don't want to answer you or they get offended by the question, and they're not proudly sharing with you what your experience is going to be getting care with them, you need to run like hell. You should ask for recommendations for people who have had safe, satisfying, and sacred. Those are my 3 S's. Birthing experiences, people who, even when it didn't go perfect, felt like they were respected, felt like there was shared decision making, and felt like their opinion and how they were feeling about everything that mattered to the people who were taking care of them.
And I would add another question to ask is, what's your training? Can you tell me about that? And I think that matters a lot. For instance, I'll give a personal anecdote. The midwife who took care of me in my second pregnancy, she was working for a group practice, and she previously had been a home birth midwife. And what that meant that mattered to me was that she really knew how to facilitate vaginal birth, and that if she were going to recommend to me that I needed a C-section, it would be because it was really the right thing to do. She had tremendous skills. And the OB who I worked with the most in that group practice was trained by midwives, and he'd been in the military previously. They also practiced trauma-informed care, which is asking, not like what's wrong with you, but what happened to you. But knowing that they had this background, to me, furthered the trust I had in them in terms of like, they really know what they're doing. And although I did have a VBAC with my son, there was space in there where it seemed like, oh, I think I'm going to need another cesarean. At that moment, I wasn't like thrilled that I would need to have another surgical birth, but I also felt like, exactly as Helena said, I had been treated with respect. I had been treated with care. I had been listened to. I had been heard. I was safe. And that meant that when I was thinking, okay, this is where we're going, I was sanguine about it. And then I also would look up the data about the hospital where you're planning on having your baby, like what's the C-section rate there? And that's a place where reputation sometimes does not align with reality. There's some hospitals that might have a reputation for being like, oh, this is where all the crunchy moms go. Well, their C-section rate is just as high as the super medicalized place. So that really matters because it tells you a lot about the culture of the institution. And the last thing I would say to ask when you go on hospital tours is to ask if the nurses have been trained in spinning babies, which is a practice to try to get moms in different positions, again, to facilitate vaginal birth. And I would say, even if the answer is no, the way that people respond when you ask the question gives you very important information. And so I think another thing is to ask yourself the question, like, what do you want out of your birth? What makes you feel safe, what makes you feel satisfied, and knowing some of it is going to be completely out of your control because birth will go the way it's going to go. But if you want a more medicalized experience, going back to some of what we talked about, that doesn't make you a bad mom, that doesn't make you like a less fit mom. That could be what you feel that you need. But just go in knowing, really, this is the full complement in terms of risks and benefits. And that's just as good as saying, like, I would like to have an unmedicated vaginal birth. It means nothing about the kind of parent you're going to be. And we need to strip away any of the shame about that.
And I would add, go to the store and buy the damn cookies for the bake sale.
That's right.
Thank you so much to you both. This has been a wealth of information and insight from both of you. And I thank you so much for sharing all of that. I confess I'm still a little bit emotional, just sort of thinking back to my own cesarean births. The memories are still a little raw, even 20 years later. I think back now and I think I wanted a medicalized birth. I didn't have these words for it at the time. And the transformation that happened within me after the cesarean birth is one that carried through for the rest of my life. Because sometimes you think you want something because you think you understand what it means. And at the end, you're like, oh, that was not at all what I thought it would be, It's such a transformative, life-changing experience. Rachel Somerstein and Helena Grant, thank you for joining me on Overlooked. It has been a fantastic conversation. Overlooked is here for information and empowerment, but not medical advice. Every person's body is unique, so if you have questions, it is best to speak to your doctor or healthcare provider. We're building a community around women's health so that no one is overlooked. If you'd like to be part of it, hit the follow button on this podcast, wherever you're listening to this. Or you can show us some love by writing us a review and sharing this episode with someone. Overlooked is written and created by me, Golda Arthur. Jessica Martinez de Hoz is the show's producer. You can stay up to date with the show by signing up for the newsletter and following us on Instagram and LinkedIn. We read every review and email, so write to us, hello@overlookedpod.com. Thanks for listening.